There are a wide range of possible reasons for injury to the central nervous system, including trauma, infection, tumors, and neurotoxins, to name but a few. There are also different symptom expressions in terms of the consequences of organic neurodegeneration, such as demyelination and axonal degeneration, which are assumed to be conditions that have occurred since the injury, regardless of the reason. However, as the symptoms differ depending on the site of injury, a corresponding injury or disease name will be assigned, but it may not be necessary to stick to the injury or disease name, as it is just a matter of if you injure that area in that way, you will have those symptoms. Because the brain is an anatomically inaccessible area for selective treatment, it has a disadvantageous aspect, unlike peripheral neurological conditions such as spinal degenerative diseases, which can be selectively assessed at higher levels of responsibility and can be diagnosed therapeutically. However, the disadvantage is only for the convenience of the surgeon, who is unable to identify the affected area, and the positive aspect is that the anatomical elements of the human body are such that therapeutic measures that nourish the entire brain can be expected to restore recovery, regardless of the affected area. The pathological hypotheses for a number of neurodegenerative diseases have many things in common. They all suggest that the cellular breakdown is caused by the body's own neurotransmitters. The name of the disease may change if the symptoms change according to the injured area, but that in itself is of little significance. Although it is unknown what will happen, even the common cold is still no cure when it comes to this. Symptoms may change depending on the site of cause, the process, and the speed of injury, but the physiology of the outcome is the same whether the symptoms are completed somewhere or not, only the cause and process are different. In this way, it is difficult to make superficial judgments about what diseases can and cannot be cured, and there is no reason to focus on the origin of the disease or whether or not it is related to symptoms due to organic findings, and the more we try to understand, the closer we get to not knowing, which in turn means that the human body is full of possibilities.